Everyone, this is David Crawford, Editor-in-Chief of Grand Rounds in Urology. Joining me for one of our monthly chats is a colleague, Representative Greg F. Murphy, MD, who represents the 3rd Congressional District in North Carolina. Hard to believe now that Greg is in his 3rd term, and we really appreciate him taking time from his busy schedule to share some thoughts with us. There's so much going on right now. One of the things is healthcare costs is out of control. We know it. Often the physicians are targets of this, and maybe Greg can comment on that. And then the other thing is the debt ceiling and what effect that might have on Medicare and physicians. So, Greg, welcome and take it away. Appreciate you.
Well, thanks, Dave. Nice to see you guys. Let me talk. I'll talk about the 2 separate issues. One is just the cost of healthcare. Everybody knows it's just spiraling out of control. In fact, since the ACA has come into being in 2013, insurance premiums have gone up on average 129%. 129% insurance premiums. And now you add on these high deductible plans and some of these other things. And so was this a good idea? I'm thinking in retrospect, not. But, you know, in trying to solve some of the problems, we had a Ways and Means conference this morning. I talked about what is really driving healthcare costs. If you look at where our insurance companies are now, insurance companies' jobs are now to deny care. We go through so many fights of pre-authorizations. We passed a great bill, bipartisan, bicameral bill that was signed in the previous administration that our HHS secretary has basically turned all the power over to insurance companies. We've had to sue to try to get that better. It's not good. So insurance companies are gathering the fact. I'll take United Healthcare, for example. Last year in the 3rd quarter made $5.6 billion. That's with a B in profits, over $20 billion for a year. So if you look at where the costs are, look at the middlemen. You look at pharmacy benefit managers added to it, those insurance companies, that's billions of dollars. You look at the different points of essentially the middlemen. You know, David, you and I have talked about administrators in medicine, how that has skyrocketed compared to the number of physicians. Why? 2 reasons. One is administrative burden, that government has got so much regulation that's going on in healthcare. It's exploded. What you have to pay, you have to have other administrators that try to deal with regulatory burden from hospitals, in hospitals. And then the fact that so much of hospitals are now doing things that are outside the scope of practice. They're doing so much about wellness in communities, experience officers, some of these other things that we need to get back to who cares for patients. And I stated today, you know, hospitals are a wonderful thing, but hospitals don't take care of patients. It's doctors and patients, doctors and nurses and other, you know, ancillary staff that take care of patients. And so I think we have to realize what the aberrancy has now occurred in the last quarter century, and that's where the real targets are. By the way, it's not physicians, because over the last 22 years, the average physician pay has gone down 22%, but they're always the ones that get targeted. So I think there's going to have to be some real stark meetings here in DC, and that we have to take back the control of patient care, doctors and nurses, and stop the middlemen that are profiting off all of this. If you want to talk about the debt ceiling, we're 2 weeks away. We will, if nothing changes, default on the debt, which means that the United States will cease to be able to pay its debts, which is payment in bonds and all these other things. We've only been in this particular debt to GDP ratio once, and that was right after World War II. And that's when we needed to expend so much money to allow veterans to build homes and some of these other things. And so, you know, there's a debt negotiation between Republicans and Democrats. We don't need to default on debt because that would endanger Medicare payments. It would endanger a lot of other things that our government pay. And there has to be some kind of compromise. I'm hoping that the White House will turn around and compromise on some of the things and not have this nation go into debt. The markets will go crazy, not only in the United States, but worldwide, and will have so many ramifications of of payment and the economies worldwide.
Right. Greg, just thinking back over the years, how many times there's been so much saber rattling over the debt, and that always at the last minute something happens. But I heard the House Speaker say something that it's like your kids in a credit card, and they keep spending, and the debt limit on their credit card is way over, and they can't pay it.
Yeah.
What do? You got to stop and take a look at it and not spend so much. I mean, that's economics 101, I think.
Yeah, and there was a pervasive thought on perhaps the other side of the aisle where I am, that all of a sudden debt doesn't matter. That's absolutely perverse. Secretary Yellen agrees that debt matters. So many of our other folks, but we have a small fraction of folks that say, well, it doesn't matter. You keep on spending. That's not how it happens. The world has faith in the American dollar, and that's because we have always paid our debts. And so these are, I pray we don't have any more saber rattling, and then we have adults that come to the room, sit down and negotiate so that we can move the country forward and get back to other things that are threatening this country.
Let me just circle back to what you said a little bit earlier about out of control physicians and the money we're spending in healthcare. I was just reading in Medscape about the new glucagon-like peptide 1 GLP drugs that are really game changers for losing weight. But this is something induced of over, almost 70% of our population's overweight, and yet 20-30% are diabetics or pre-diabetics. And you've got these drugs. I counted there were six companies: Eli Lilly, Pfizer, Opco, Amgen. It goes on and on and on, that are, expect this to be $100 billion issue. And that's a lifestyle drug in a way, but it's also important because we're not prevention. We're treating sick people, because a lot of it has to do with their behavior and being overweight and not taking care of themselves.
Well, if you look at where the epidemic of obesity started in this country, it's really processed foods. You go over to Europe, the obesity problem is non-existent. They don't have nearly the number of processed foods that you and I have in this country. My gosh, you drive down Main Street, USA, you've got every fast food restaurant in the world just out there for the wanting, out there for the purchasing. And so it begs the other question, David, is who pays for all of this? Who pays for all of this? We're buying all these bad foods for us, and then we're trying to purchase a pill that probably has side effects to try to get out of it. How do we pay for all this nonsense? And premiums will go up, and then people can't pay the premiums. It's time for personal responsibility to come back in on this stuff. And
we're trying to do that with being a urologist, about androgen deprivation therapy, and we are extending lives. We got all these new drugs. It's exciting. Some of them are expensive, some of them have been around for a while. But if you look at side effects of androgen deprivation therapy, cardiovascular and otherwise, are significant. And a lot of that can be averted with lifestyle changes. We're working hard on that. One of the things that you mentioned also is healthcare providers and one-on-ones and peer reviews before you can do anything. I had a patient a couple of weeks ago, needed a PSMA, and so I had to have a one-on-one. I was on the phone 20 minutes. And this patient was clearly a patient who newly diagnosed and met all the FDA criteria. And then they kept switching me because I wasn't giving up and going up the ladder. And then finally I got disconnected and wasted 23 minutes. It's harassment. It really
is harassment. And it's, I look at our insurance company executives. I wish I could sit in their boardroom, and it's basically how to deny care. And that's what they're doing. They're putting in denial of care. Now, I will say this, David, and I would say this sometimes even to our younger physicians that order more tests than are necessary, and they order them just because they want to know the information. The bottom line is you should not order a test unless you are going to change your plan of treatment for that patient.
Action.
We've
Yeah.
had every time, you have a drug rep or a company come in and peddle a new test or a new drug or something, you have to constantly ask, what is this going to change for the patient? And if you're doing it, say, for academic information, just because you want to know, then maybe you ought to pay for it out of your pocket. But it doesn't need to come out of the patient's pocket.
There's a lot of interesting things going on. Mark Cuban and what he's doing and other
Yeah,
things.
met
We
with
can
him the
talk
other
about
day.
that. Maybe we can talk about that next time. As always, Greg, this 10 minutes with you is so valuable, and our listeners do appreciate it. I get so much feedback on it. Thanks so much. And we look forward to talking next month, and I hope we get this debt thing solved.
Yeah, hope so too. Take care. Thank you.
Thank you.